Good afternoon, everyone, and welcome to the webinar for the launch of the 2020 edition of the Sanofi Canada Healthcare Survey Report entitled Future Forward, Frontline Perspectives on the Future of Health Benefit Plans. My name is Andrea Frankel, and I am the National Private Payer Lead at Sanofi Canada, and I'll be your moderator for today's session. Sanofi Canada is the publisher of the report in partnership with Context Group, publisher of Benefits Canada, and in partnership with our valued sponsors in the benefits industry, who I will be introducing shortly. Before we begin, just a couple housekeeping notes. The webinar will be approximately 1 hour in duration, including time for a Q&A session after the presentation. On the bottom right-hand corner of your screen, you'll see a button that says Email Text Support. Should you encounter any technical issues during the webinar, please click that button and it will generate an email to the technical support team for you. Beside that button, you'll see the option to ask a question. And if you select that, a window will then pop up that will allow you to ask a question at any point in time throughout the webinar. For a copy of today's PowerPoint presentation, as well as the complete Sanofi Canada Healthcare Survey Report, please go to www.sanofi.ca. You'll find the material under Product and Resources, and it should be uploaded sometime within the next 24 hours. Now, here's our agenda for this morning. This year's survey findings are broken down into 4 main sections as presented in the report itself. This morning, we will present highlights from these 4 sections. The wellness picture will be co-presented by Barb Martinez from Canada Life and Marie-Chantal Cote from Sun Life. Adrian Ibrahimi from SSQ Insurance will take us through 2 sections, the value of health benefit plans and a closer look at the drug plan. And finally, Bill Papadimitriou from Desjardins Insurance will present future considerations. Sanofi Canada is very proud to produce the Sanofi Canada Healthcare Survey. Sanofi is a leading global pharmaceutical company with therapeutic solutions in many areas, including diabetes, oncology, cardiology, internal medicine, as well as vaccines. This year marks the survey's 23rd anniversary, and it is by far the longest running survey of private health benefit plans in Canada. An important goal for Sanofi is that the survey and resulting report contribute to improved collaboration between all stakeholders in the benefits community, pharmaceutical companies, and the public healthcare system. Our common ground is the health of our patients and plan members, and by working better together, we can do more to improve health and mitigate illness. As a pharmaceutical manufacturer, we learned so much about the health benefits industry by championing this survey, and we're thrilled that its findings have come to serve as a landmark reference and educational tool for key stakeholders. Our goal is to contribute to your understanding of the underlying drivers of illness and disability in the workplace, and help illustrate how these connect to productivity and ultimately profitability. Analysis of the survey results is guided by an amazing advisory board. Since 1997, we have captured the opinions of more than 35,000 Canadian benefit plan members. And since 2012, when we began to survey plan sponsors, we've captured the opinions of more than 3,600 employers. In terms of the methodology, the survey is national and it's conducted online. For this year's survey, we had 1,500 plan member respondents and 516 plan sponsor respondents. As in previous years, the survey occurred in January and early February. Therefore, the results are pre-COVID-19. Members of the advisory board also met in person to discuss the survey results at the end of February. When we apply the COVID lens to the survey results, we feel that most of the results still stand. And we were actually even discussing this morning that, interestingly, some of the results may even be more applicable and more relevant post-COVID-19. The following 2 slides summarize key demographics for the survey respondents. In the interest of time, I won't go into detail. but this information is available for your reference when you download the presentation at sanofi.ca. The survey owes its success to the dedicated members of the advisory board, representing all industry stakeholders as well as healthcare professionals. I'd like to take a moment to recognize and sincerely thank the members of our advisory board. Representing plan sponsors, Susan Belmore-Vermes, Carol Craig, Talena Usorin. Representing the insurers, we have Barb Martinez and Ryan Weiss, Melina Lamarche, Mark Bertassini and Bill Papadimitriou, Sarah Murphy, Julie Gaudry, Adrian Ibrahimi, and Brigitte Marcoux, and Marie Chantal Cote. Representing the benefit advisors and consultants, Shannon Darville, Chris Bonnet, Dave Patriarch, and John McGrath. And finally, representing our healthcare providers, Dr. Alan Soto and Mark Rolnick. Last but not least, I'd like to take a moment to recognize and sincerely thank this year's supporting partners, without whom we could not have proceeded with this 23rd edition of the Sanofi Canada Healthcare Survey. This year's diamond sponsors are Canada Life, Desjardins Insurance, SSQ Insurance, and Sun Life. Our platinum sponsors are Green Shield Canada, Health Solutions by Shoppers Drug Mart, People Corporation, La Capitale, and RBC Insurance. And now it is my pleasure to turn the webinar over to our panel of presenters to present highlights from the 2020 edition of the Sanofi Canada Healthcare Survey. Barb Martinez from Canada Life will lead things off with our first section, the wellness picture.
Thank you, Andrea. We are now proceeding to our first section of results entitled The Wellness Picture. This presents highlights from Chapter 1 of the report. To start us off, I'd like to quote one of the benefits advisors on the advisory board, Shannon Darville of Silverberg Group, a People Corporation company. Based on the survey results, Shannon summarizes that the message is clear that the high marks go to workplaces with a positive wellness culture. All stakeholders, plan sponsors, insurance carriers, and consultants can really build on that together. And for employers who don't have a wellness culture yet, we can make it a goal to bring them on side, one step at a time. Let's look at the results to get more insights. Now, looking at workplace culture, the good news is that the majority of plan members, 77%, already agree that their workplace culture or environment encourages health and wellness. We want to maintain and build on that. For the first time this year, we asked what comprises a wellness culture in their own workplace, based on a list of 13 possible factors. The top 3 factors are safety, good relationships with coworkers, and a good relationship with the immediate supervisor. We asked both plan members as well as plan sponsors to answer this question. One thing to highlight is that although both groups were aligned in their rankings, plan members were less likely to indicate certain factors were evident in their workplace. For example, when we looked at reasonable workloads, you'll see that 54% of plan sponsors indicated that reasonable workloads contributed to their wellness culture. Whereas here on this slide, we see that only 39% of plan members said the same about reasonable workloads. More details can be found in the report. As indicated on this slide, plan members with a wellness culture are much more likely to be satisfied with their job, 90% compared to 61% without a wellness culture. And 74% then also describe the quality of their health benefit plan as excellent or good, compared to just 48% among those without a wellness culture. A wellness culture is also a factor in attraction and retention. 86% agree it's an important factor when deciding on a job offer or remaining at an organization. 29% strongly agree with this statement. We're going to shift our focus now to what plan sponsors are planning to do more broadly in terms of wellness supports or programming. In the next 3 years, 75% plan to invest in health and wellness areas outside of the health benefit plan. Among those with plans, they are most likely to invest in funding or staff resources in the area of mental health, followed by the prevention of illness or management of chronic health conditions. The key takeaways for this section are: a wellness culture plays an important role in attraction and retention, as well as job satisfaction, which in turn drives productivity. More can be done to capitalize on this, given the gap between plan members and plan sponsors' perceptions on what contributes to a wellness culture. Plan members' top 3 factors for a positive wellness culture are safety, good relationships with coworkers, and a good relationship with the immediate supervisor. Supporting employee health and wellness is a priority for plan sponsors, as evidenced by their level of commitment to invest in this over the next 3 years. Additional findings in the report include alternative work arrangements are highly valued by some workforces, and we can probably expect that to be even more true in light of the COVID-19 crisis. As well, non-financial incentives such as senior leadership and fun activities are effective to encourage participation in wellness programs. Now we're going to take a look more closely at the wellness picture and personal health. As in past years, almost all plan members describe their health as good, very good, or excellent. While personal bias likely leads to results that are more positive than the reality, generally speaking, plan members appear to be on the positive side of health. Only 8% describe it as poor, though this jumps to 24% among those taking 3 or more medications. Interestingly, job satisfaction also appears to have an effect on perceived personal health, as poor health increases to 18% among those who are unhappy in their jobs. Last but not least, those who say their benefit plan does not meet their needs are more likely to be in poor health. Looking at plan members' use of digital devices, etc., we found that these results were quite interesting. In 2015, the survey asked plan members if they used a digital device or app for their personal health in the past year. We asked the same question this year. As you can see, utilization has gone up across the board for all of the options listed here, from fitness tracking devices, mobile apps, websites, and online health risk assessments. Perhaps not surprisingly, plan members aged 18 to 34 are much more likely to use any of these options than plan members aged 55 and older. 70% of younger plan members did, compared to just 31% of older plan members. What's encouraging, though, are the results on the following slide. Plan members in poor health or with chronic conditions have become much more likely to use at least one digital health tool. 5 years ago, the results suggested that people who are already in good health are more likely to use digital tools, which is still great, but it's encouraging to see that the people who may benefit from these the most have become more receptive to using them. Our key takeaways for this section are: the increased use of digital devices and apps to help achieve health or fitness goals is encouraging, particularly among plan members with poor health or a chronic disease who were historically less likely to use these tools. The use of online health risk assessments is low compared to the other digital tools, yet uptake has grown. During the advisory board meeting, we discussed how this could be an opportunity to renew efforts for plan members to complete insurers' online tools, since they can offer up a bedrock of validated data for employers to use to upgrade their health benefit plans. So that concludes part 1 of this section. I will now introduce Marie Chantal Cote of Sun Life to walk us through the rest of the wellness picture.
Thank you, Barb. Let's now move into looking at mental health. So let's look at a quote from Bill Papadimitriou from Desjardins Insurance. Mental illness has reached alarming levels amongst teens and students in universities, and that is our future workforce. We already see the shift in claims data. The solution is not just about more money, it's about using technology to improve access and increase cost effectiveness. we have to get at this now, or else mental health claims at staggering levels are going to be the new norm. So let's look at the data a little bit together. So as we can see on the slide, the stress that is being reported by employees. So on the left, we can see in general that about 46% of employees are reporting a moderate amount of stress, but 30%, so almost a third of all employees are reporting an extreme to high stress level, which is comparable to 2018. An interesting data point around this is that this number, the 30%, does increase to more than 50% when you look at plan members not satisfied with their jobs. So there is a correlation between being less satisfied with your job and feeling more stressed. As we look on the right at the main sources of stress, personal finances continues to be at the top, and that is unchanged from the last 2 years. The next three are tied into work and work environments. So about 30% of plan members do report feeling some stress tied into workload, balancing work and life, and interacting with people at work. Let's now take a few minutes to look at the actual impact of the stress being experienced by employees. So we've looked at 2 data points to look at the actual impact and absenteeism or productivity. So on the left, it was specifically the number of times that an employee would arrive late or leave work early because of stress. And on the right is actual people needing to take sick days because of stress. So on the left, about 36%, so a third of plan members have reported arriving late or leaving early because of stress. And that goes up to 45% for employees in less good health. And this materialized itself in, for the 36%, this occurring about 5 times in the year, but then going to almost 10 at 9.4 times for the group in less good health. And then on the right, when we look at the difference, so 41% of plan members have needed to take at least 1 full sick day because of stress, and that goes to 53% for employees in less good health. But the real difference is also in the number of sick days needing to be taken off. So the group in blue have needed to take 5 days sick because of stress, while the group in gray, those in less good health, have needed to take almost 11 days per year because of stress. Another interesting lens is around the actual demographics, and you'll see in the difference in the size of the gray boxes to the blue boxes, and the gray boxes representing the demographic of 55 and older, while the blue represents the age group population of 18-34. You can see the difference in, on the left, the stress level being felt, and on the right, the actual impact. So while we have 22-23% of people 55 and older reporting stress levels, that is 34 to 42% when we look at the actual 18 to 34. And that difference is even more material when we look at the impact, where almost 50% of the 18 to 34 have reported arriving late or leaving work early because of stress or taking at least 1 sick day, compared to 17-20% for the 55 and older. So a really big difference there, as mentioned by Bill in his initial quote. Looking quickly at some of the programs, so on the left, we've seen that about 51%, so about half of the employers offer mental health training programs for managers or for employees. But we've seen some differences in results based on different types of organizations. For example, if we look at the size of an organization, we have seen that the larger organizations, those with 500 or more employees, 72% of those are reporting having the mental health training programs available, while that number is only 22% for smaller employers with fewer than 50 employees. Also, we're seeing a difference in unionized versus not unionized organizations. So where they're unionized, about 2/3, 67% offer such training, and that's only 45% for non-unionized workplaces. So a difference there also. If we look on the right, another thing we're seeing is organizations reassessing their maximums for counseling services for mental health within their plans. So 18% have actually made some changes. 25% haven't yet, but are planning to. And right now, the median annual maximum is at $1,011. So let's pause and look at the key takeaways so far. So as mentioned, and you saw it in Bill's quote, and you saw it throughout the deck, one of the key takeaways is that the younger employees, our future workforce, is reporting higher levels of stress felt and much higher impact to them. That's a key takeaway. Another one is the fact that mental health training continues to be a key tool in the toolkit, as are other tools like internet-based CBT, which is emerging, etc. And finally, one of the other tools in the toolkit is around increasing the maximums for mental health counseling, and we are seeing some organizations either do that or think about doing that. So I propose we now move into chronic disease management as the last section to talk about this chapter. So the quote from Suzanne Belmore-Vermes from the Health Association in Nova Scotia: "It can be a struggle to get the data for support. It can be a struggle to get the data to support future actions. Plan sponsors want to do more in chronic disease management support, but we need constructive integrated claims data analysis. We need simple benchmarks to tell us if we're above, below, or on track. Insurers and advisors who do this can really set themselves apart, and plan sponsors need to seek them out." So let's look again at the data together. On the next slide, a very interesting data point from my perspective, if we compare the blue and the purple lines on the left. So the purple is the estimation of plan sponsors of how many employees within their organization suffer from chronic disease. So that's 34%. And then the blue is actually how many plan members are diagnosed with at least one chronic disease, at 58%. So you can see a significant difference between plan sponsors' estimates versus reality. And when we look at that and we overlay the plan members with a chronic pain, and that's about 48%, we end up with about 70% of employees suffering for either a chronic condition or a chronic pain. And that has an impact, as you can imagine. So we're continuing to measure the same types of metrics. So missing work, arriving late or leaving work early, taking full sick days. And you could see that more than half of employees have missed work or found it harder to do their job because of chronic condition or chronic pain. That about half have arrived late or left work early because of it. And that occurred about 4.7 times. And 63%, so about 2/3, took at least one full sick day because of it, and that 63% actually took six sick days in average because of that. We're continuing to see some differences in the demographics. So again, comparing age groups, blue being 18 to 34 and gray being 55 and older, you can see that the impact of chronic conditions or chronic pain is felt even stronger amongst the 18 to 34, in particular around arriving late or leaving early in the past year, where that goes from 32% for 55 and older to 66% in 18 to 34. But everywhere across the board, we can see that the impact is stronger with the 18 to 34 years old group. So before we wrap up, let's take a last look at the key takeaways for this section. So the first one is probably, as we mentioned, the underestimation of the number of plan members suffering from chronic condition. As we saw, that number is quite a bit higher in reality than estimates. So definitely needs some attention. The second piece is the impact that chronic condition and chronic pain does have on productivity, on absenteeism, etc. The other piece, as we mentioned, is the difference in impact to the younger employees. We also saw that the workplace itself doesn't appear to be a driving factor behind the greater impact of chronic conditions on the 1834. So it's because they're as likely as other age groups to give high marks for job satisfaction and a workplace environment that promotes health and wellness. So the data that we're seeing around the impact to 1834 is not tied into job satisfaction, which is an interesting data point. And finally, what we're seeing is that actionable data continues to be key to decision making in that space. So I guess that closes out this chapter. So thank you very much for listening, and I'd like to pass the baton to Adrian.
Thank you, Marie-Chantal. In this section, we focus on perceptions of value for the health benefit plan. Let's begin with a quote from another plan sponsor on the advisory board, Carol Craig, Director, Pension and Benefits at TELUS. Carol noted, if you are considering a plan redesign, ask plan members what they value. Focus groups can give especially good insights, but don't engage employees unless you're truly ready to listen. Let go of assumptions and respond to the feedback you receive. Now, we see that with respect to plan member perceptions of the quality of their health plan, 20% of plan members describe the quality of their health plan as excellent. 48% describe it as good, 28% as adequate, or neither good nor poor, and 4% describe it as poor. As shown on the right side of the slide, health status, a wellness culture, and health spending accounts influence results. Unfortunately, a relatively low 54% of plan members in poor health describe their plan as being excellent or good, compared to 80% among those in excellent or very good health. 78% of members with HSAs say their plan is excellent or very good, compared to 61% among those without HSAs. And a wellness culture boosts positive ratings from 48 to 74%. Now, these two survey questions try to get at value perceptions from different angles. The top question asks plan members whether they value their benefit plan more for its ability to help pay for regular or routine healthcare costs, or as a source of insurance for unexpected and possibly high healthcare costs. Plan members could also select both equally. It appears the plan members feel more strongly about its value for regular or routine costs, as that option increased from 51% in 2018 to 59% in 2020, and fewer plan members selected both. At the same time, fewer plan members appear to have an entitlement mentality. In the second question, the survey asked plan members to select from two statements to best describe how they view and use their health benefit plan. Only 22% view their plan as extra compensation and try to use it as much as they can to get their money's worth, down from 35% in 2016. Respondents were also less likely to say both, and more likely, at 60%, to say the plan is there to help take care of health, and they try to use it only when sick or to prevent illness or injury. For plan sponsors, the health benefit plan delivers value in terms of attraction and retention. 86% of plan members agree that their health benefit plan is an important factor when deciding on a job offer, up from 78% in 2014, and 33% strongly agree in 2020. And when it comes to retention, 71% of plan members agree that the health benefit plan is a strong incentive for them to stay with their employer, up from 61% in 2012. As noted in the report, a few factors appear to influence results. For example, 82% of plan members with HSAs agree that their health benefit plan is a strong incentive to stay with their employer, compared to 64% among those without an HSA. For their part, 46% of plan sponsors indicate that it has become more difficult to attract employees over the past 5 years. 40% feel it has become more difficult to retain employees. And this leads us to our key takeaways for this section. Now, health benefit plans fall short for those who likely need it most. As in previous years, plan members in poor health are much less likely to be positive about the quality of their health benefit plan or to say that it meets their needs. Plan members' perceptions of value reflect, in part, plan sponsors' efforts to position benefits as part of compensation. At the same time, the finding that fewer plan members appear to feel entitled suggests a greater appreciation of their health benefit plan's intrinsic value, i.e. to support their health. The association between perceptions of value and health spending accounts illustrates the value the plan members place on having some control over how they can use their health benefit plan. Now, plan design also factors into perceptions of value. Let's begin with this quote from Marie-Chantal Cote of Sun Life Financial. Now, Marie-Chantal noted, technology is enabling the industry to explore new and better ways to bring flexibility into plan design. And as plan members exercise their choices and become more familiar and engaged with their benefit plan, we will see greater opportunities to proactively interact with them. For example, with recommendations that support healthy behaviors. 71% of plan sponsors have a traditional plan and 29% have a flex plan. In 2017, when this question was first asked the plan sponsors, 80% had a traditional plan and 19% had a flex plan. As expected, employers with 500 or more employees are more likely than employers with fewer than 50 employees to have flex plans at 39% versus 18% respectively. The report also notes that among plan sponsors with a traditional plan, 67% would prefer a flex plan. Health spending and wellness accounts have seen greater increases in the past 3 years. 57% of plan sponsors in 2020 report having an HSA as part of their health benefit plan, up from 31% in 2017, and 35% have a wellness account for taxable items, up from 14%. As noted in the report, larger employers are more likely to offer HSAs, but growth has been strong across all sizes. Also in the report, 51% of plan sponsors anticipate that HSAs will play a more significant role over the next 5 years, up from 36% in 2018. Now, among plan members with HSAs, virtually all of them, 93%, agree that they like having the account. 53% strongly agree. The report also gives more details on utilization levels of the HSAs. Among plan members who do not have HSAs, 82% agree that they would like to have such an account as part of their workplace health benefit plan. And this leads us again to our key takeaways for this section. The migration toward more defined contribution benefits reflects the growing desire among both plan members and plan sponsors for greater flexibility. As well, it's a win-win in terms of perceived value for members and as a cost management tool for sponsors. During the advisory board meeting, we agreed that HSAs and wellness accounts can cost-effectively add flexibility, particularly when flex plans may not be an option, for example, for small employers. However, the advisory board strongly cautions against crossing over fully to HSAs and wellness accounts. Dropping all insurance protection will lead to unintended consequences, such as more sick days and higher employee turnover. Insurance coverage is highly valuable, and communication efforts for HSAs need to give equal weight to the value of insurance coverage available from the core health benefit plan. Before making any changes to plan design, the advisory board recommends benchmarking against the rest of the industry and clearly defining what the plan sponsor is trying to achieve with the health benefit plan. The definition of purpose needs to guide all decision making. Now, let's take a few minutes to focus on drug plans and the issue of adherence. Setting the stage, I noted the following. Non-adherence to prescribed medication can have significant health consequences, and yet some plan members are running out of their medications. They're telling us it's inconvenient to go to their doctors for renewals, and they're willing to go to the pharmacist instead or to use virtual care. Let's connect those dots and close this gap on medication adherence. Now, we see that 55% of plan members take at least one medication on a regular basis. This increases to 70% among plan members with a chronic condition and/or chronic pain. 23% of plan members with a chronic condition and/or chronic pain take 3 or more medications regularly. This increases to 48% among plan members in poor health who take 3 or more medications. we see that 43% of plan members who take at least one medication agree that they sometimes do not take their medication, increasing to 61% among those aged 18 to 34. 52% of plan members who do not always take their medication indicate that this occurs at least a quarter of the time. This frequency is significant because it crosses the threshold for non-adherence, which is 20%, at which point the drug may not work as effectively as it could. Interestingly, job satisfaction is among factors that appear to influence results. As shown here, non-adherence increases to 66% among those who are not satisfied with their job. Younger plan members and those experiencing high levels of stress are also more non-adherent. If you'd like more information about levels of non-adherence, I recommend the annual Express Scripts Canada Prescription Drug Trend Report. The 2019 report, for example, states that 70% of plan members with asthma are not adherent to their medications. Now, forgetfulness is by far the biggest reason for not taking their medication at 41%, followed by the perception that the drug is not needed or that they feel fine at 24%, and the fact that they ran out of medications at 20%. Convenience may also be a factor. 69% of plan members agree that it is inconvenient to go to their physician to get their prescriptions renewed. Additional results in the report indicate that plan members are willing to use virtual care or go to pharmacists as more convenient options for refills. And this leads us to key takeaways for this section. Now, levels of non-adherence are a call to action to raise awareness among plan sponsors, to alert them that they may not be seeing an optimal return on investment for their drug plans. Plan sponsors and their providers can revisit and update initiatives that support adherence. For example, as I had suggested in my quote, benefit providers may be able to take practical steps to reduce how often plan members run out of their medication. This concludes my portion of the webinar. Bill Papadimitriou of Desjardins Insurance will present our concluding section on the future of health benefit plans.
Great, Adrian, thank you. For our last section, we'll look ahead a bit at the evolution of health benefit plans. Remember, this survey was conducted prior to the COVID-19 pandemic, so as we go through these slides, perhaps we should also consider how this new world will influence decisions for change when it comes to health benefit plans and generally supporting employee health. To get us started, I'd like to share this quote by Ryan Weiss, Canada Life, about targeted communications. Insurers are piloting target member communications and refining approaches based on the feedback. For example, we found that people are really interested in learning about their risks for future health issues and what to do about that. And plan sponsors see real value in helping their members be proactive about reducing these risks. Before we find out more about targeted communications, we take a brief step back for a bit of a bigger picture. First, let's consider the top challenges or concerns. 79% of plan sponsors have at least one major concern about their health benefit plan. That's up from 66% in 2018. And it increases this year to 89% among large employers, 500 or more employees. Among the 79% who have concerns, the top 5 out of a list of 8 provided options are drug plan sustainability, dental plan sustainability, absence and disability, use of paramedical benefits, and fraud. These rankings mirror the top 5 list in 2018 with the exception of fraud, which is new on the list. The survey also asked plan sponsors what they felt is most important to them in terms of improving their health benefit plans. And we see that they feel equally strongly about doing more for plan members with major chronic diseases who are likely taking high volume, lower cost drugs, as they do about improved coverage options for high cost specialty drugs taken by a very small percentage of plan members. After these top 3 options, plan sponsored would most like to improve disability management, and the prevention and detection of fraud. 88% of sponsors agree that they would like their health benefit plans to do more to support plan members with chronic diseases. This is up from 82% in 2019 and 79% in 2018. 88% of sponsors also agree that they would prefer for their insurer to go ahead and make products or services available related to chronic disease management available in their health benefit plan so that they do not have to request or opt in for the new benefit. It's worth noting here that the survey question made no mention of the cost to the plan sponsor. How can sponsors do more for members with chronic conditions? 41% of plan members with chronic conditions and or chronic pain would like their health benefit plan to provide higher levels of coverage for existing products or services, and 23% would like coverage for new products or services. About a third say current coverage is fine. Moving on to targeted messaging, we want to highlight this slide as a knowledge gap because plan members and plan sponsors appear to be diverging in terms of levels of readiness in an area that we see as very important to the evolution of health benefit plans and the general support of employee health. 62% of plan members would consent to receive health-related information based on their personal use of benefits from the insurance company, which is comparable to previous years of 65% in 2019 and 66% in 2018. But it's not going up despite the pervasiveness of targeted communications in the rest of our daily lives. Plan sponsors, meanwhile, are increasingly interested in having their benefits providers send targeted communications to plan members. 79% in 2020, up from 74% in 2019 and 64% in 2018. From an industry perspective, we know that technology is becoming more and more sophisticated to deliver targeted messaging, and many carriers are piloting how best to roll this out. Privacy concerns are an issue. 66% of plan members are confident that their insurance company will protect their privacy when sending targeted health information, and that's unchanged from last year at 65%. While this may be good enough in other sectors, all members of the advisory board agreed it's not high enough. As you'll read in the report, plan members' experiences as consumers may be a reason why interest is not growing in targeted health information. When asked if they are fine with organizations such as Facebook or Amazon suggesting products or services, not many more than half agreed. We were a bit surprised to see this result, thinking it would be higher, which suggests that consumers may be getting tired or distrustful of such personalized messaging. So, key takeaways. Survey results strongly suggest that plan sponsors would like new options or approaches for the coverage of higher cost specialty drugs so that they can better manage their exposure to risk. The finding that almost 9 out of 10 plan sponsors would prefer their insurers to include new benefits for chronic disease management rather than require opt-ins is a powerful indication of their desire to do more in this area, especially given that the survey question made no mention of potential costs. For their part, plan members with chronic conditions and or chronic pain are almost twice as likely to want increased coverage for existing benefits rather than coverage for new benefits. This suggests co-insurance may be a challenge for some. The growing gap between plan members and plan sponsors regarding targeted health messaging should be a cause for concern. Benefits providers and plan sponsors can step up communications on how privacy will be protected, and equally important, how such messaging can help manage chronic conditions or diseases and overall health. Insurance carriers and other benefit providers also need to tread carefully to avoid language that suggests the selling of a product or service. Instead, the focus must be on recommendations or advice based on credible sources of information. Last but not least, plan member reluctance may be because current interactions with insurers are largely transactional. It will take time and education for members to accept that insurers can play a role in personal health management. So in this section, we consider actual emerging benefits. Give us a preview of what's on the wish list. Here's a quote from Melina Lamarche of Le Capital. Virtual healthcare is expanding, and rightly so. It provides personalized medical support anytime, anywhere. The financial benefits are significant, and employees are very interested. They are ready. The time has come to seize such opportunities to reinvent group insurance through digital means. Well, those were wise words from Melina based on where we're at today. So when presented with 15 possible new benefit offerings, some of which would be covered by health spending or wellness accounts, plan members' top 5 selections are immunizations for infectious diseases, fitness classes, health risk screenings with healthcare professionals, 24-hour virtual care, and genetic testing to help determine risk for certain diseases. When asked what they would be interested in covering, plan sponsors are aligned with members regarding immunizations, which tops the list for both sponsors and members. They're somewhat aligned with screenings, virtual care, and fitness classes. However, genetic testing is well down the list for sponsors. Instead, they're more interested in covering one-on-one education with a healthcare expert for people with chronic conditions. These are remarkable considering where we're at today. The survey then posed the scenario that their employer may arrange for discounted prices for these products and services rather than add them to the health benefit plan. Would plan members view their employer more positively or more negatively if such discounts were made available? 63% of plan members would view their employer more positively as a result. Only 4% would view their employer more negatively. In a separate question, we went into more detail regarding virtual care. And I don't think this is surprising today that 71% of plan members say they're willing to use this form of virtual healthcare. If we were to ask this question today, we know the results would be much higher. So, key takeaways: vaccinations against infectious diseases emerge on top as a new benefit that plan members would use and plan sponsors would like to cover. A remarkable result since the survey was conducted months before the COVID-19 pandemic. Virtual care is another benefit that is ready for deployment, as a number of benefit providers have begun partnerships with suppliers in the past year. The high ranking for virtual care has climbed since the survey was done in January, given its widespread deployment during the pandemic. Plan members' desire for such items as fitness classes, genetic testing, and pet insurance point to the value that they would likely place on wellness accounts or optional discounted benefit offerings. In conclusion, we'd like to share a few slides that focus on the importance of planning and strategy. Medical evidence can be an important part of that process, as Sarah Murphy of Green Shield Canada explains. Analysis should include a critical evaluation of what's in health benefit plans today. A key touch point is medical evidence. What does the research say about health outcomes? If benefit plan dollars are limited, should we continue to pay when there is not enough evidence? Strategies include making some benefits optional, moving them to spending accounts, or discontinuing the benefit. This process makes space for new offerings with proven health outcomes. Planning and strategy involves many layers, and our survey, which we try to limit to 10 minutes for respondents, can only touch on it. But year after year, we found that two elements of strategy, the setting of objectives and the getting of correct data, are important determinants of behavior. We start here with the setting of objectives. 61% of plan sponsors agree that they have a specific objective for their health benefit plan in the coming year, i.e. increased education of employees. And that's comparable to previous years, 65% in 2019 and 56% in 2018. We like to highlight that 21% of plan sponsors strongly agree that they have a specific objective. We see that plan sponsors with a specific objective are much more likely to want to do more to support plan members with chronic disease. That's at 94% versus 78% among sponsors without an objective. They're also more likely to describe the quality of their health benefit plan as excellent or good, much more likely to be investing in wellness, and they are more interested in the sending of targeted health information to plan members. We see a similar pattern emerge when the survey asks about claims data analyses that help plan sponsors identify the main disease states in their workforce. 22% say they regularly receive such reporting comparable to previous years. 24% in 2019 and 19% in 2018. An additional 48% report getting that information occasionally when requested or by pulling the data themselves from the carrier system. Employers with 500 or more employees are somewhat more likely to get this information regularly at 27%, compared to 12% among employers with fewer than 50 employees. Among the 31% who do not get this data at all, more than half would like to. Again, plan sponsors who receive reporting on their top disease states are more likely to take action that support employee health and productivity, as well as we'll see in the next slide. Similar to the slide about having a specific objective, we see that plan sponsors who receive reporting on disease states are much more likely to want to do more to support plan members with chronic disease. That's at 87% versus 60% among sponsors without this reporting. They're also more likely to describe the quality of their health benefit plan as excellent or good, much more likely to be investing in wellness areas in the next 3 years, and much more interested in the sending of targeted health information to plan members. So key takeaways. The right information in the setting of specific objectives can move actions beyond cost containment and into long-term gains from improved employee health and productivity. Plan sponsors' lack of time can be a major barrier to the sharing of data, let alone the setting of strategic objectives. It can take time, repeated effort, and creative communication to capture plan sponsors' attention enough so that we can make time for long-term planning. The stronger the connections that can be made between health benefit plans and overall business objectives and to occupational health and safety, the greater the level engagement by plan sponsors. As has become the tradition for the Sanofi Canada Health Survey, we like to wrap up the report with an article that distills the major findings down to one page of doable actions. In keeping with our theme, Future Forward, this year's one-page wrap-up focuses on 7 priorities that pull together the survey's findings on personal well-being, the workplace environment, and health benefit plans. We invite you to check that out on page 36 of the report. That concludes our presentation of the highlights. We look forward to answering your questions. I'll now turn things over to Andrea to moderate the Q&A. Over to you, Andrea.
Thank you, Bill, and thank you to our wonderful panel of presenters, Barb from Canada Life, Marie-Chantal from Sun Life, Adrian from SSQ, and Bill from Desjardins. I'd just like to reiterate that for a copy of this morning's PowerPoint presentation, as well as the complete survey report, please go to www.sanofi.ca and you'll find all the materials under products and resources. And again, they should be uploaded in the next 24 hours. Thank you to all the participants as well. We're going to now go to our Q&A session, and we have a number of questions that came in. So I'm going to start with one, and I will address it to Bill, if you can answer. Relative to the levels and impact of stress, were there stats to share for the 35 to 54-year-old age band?
Thanks, Andrea. Yes, there were. And I think the question was, have you experienced a severe stress incident in the last 3 months? And for young people, 18 to 34, the answer was 34%. And for the middle age group, 35 to 54, the response was 31%, or very consistent between the two age brackets.
Thank you, Bill. And do you have any comments on why young people are feeling so much more stressed?
From my perspective, I think it's just the pressure that young people are experiencing. I think Marie-Chantal may have some additional input there with regard to what they're feeling, and then the lack of stigma that exists in the industry or in Canada today.
Yes. So yes, exactly. So a couple of hypotheses we can think about, as Bill mentioned. So it's a little bit hard at this point to have all the data, but one of the things we can hypothesize is maybe younger people are experiencing more symptoms, or maybe they're more comfortable with less stigma, speaking up about their symptoms and speaking up about the tools, the solutions that they leverage tied into those symptoms. So the conversation we still need to look at the data and better understand if the symptoms are stronger, or if it's the actual stigma that is getting removed and people are more comfortable speaking about it in younger generations.
Thanks, Marie-Chantal. We had another question. I'll address it to Barb. Despite an explosion in wellness offerings, now over $1 billion industry in Canada, a recent study from Harvard showed that organizations with a wellness program and those with no wellness program had similar absenteeism and job performance. Would it be possible for a panel member to comment on whether they expect to see wellness program offerings by organizations continue to grow, or do they expect to see a contraction? And then the next part of that question was, will employers continue to contribute when productivity, absenteeism, et cetera, do not improve? This despite improvements in employee satisfaction.
Sure, I'd be happy to address that question, Andrea. So because there's such a huge variance in wellness programs between employers, the survey really focused on asking members about wellness culture instead. And to me, I think the big takeaway was that 86% of members that said they had a positive wellness culture at work were more likely to either stay with their employer or accept a job with an employer based on that. So, from the perspective that, many employers would say that a key component of benefit plans is attracting and retaining employees, to me, that this really demonstrates there's a high ROI on having a wellness culture. Again, it's hard to get into an individual program because they can vary so much, but having a wellness culture is clearly attracting and retaining employees, which is a major objective of benefit plans. So I think that's just going to continue. I don't see it reducing at all.
Thank you, Barb. I also just wanted to add, there are a lot of questions that are coming in on specific numbers and statistics. For those questions, you will be receiving an individual email with the responses there. I think I'll turn over the next question to Adrian. The survey keeps pointing to the need for more or better reporting, Adrian, in order to better tackle chronic disease in the workforce. I think we know the data is all out there, but it just doesn't seem to be consistently reaching plan sponsors, or plan sponsors are just not paying attention. Can you comment on how we can move forward on this? And secondly, is the size of the employer a factor? Thank you.
Thanks, Andrea. So the size of the employer is definitely a major factor. I would say that generally speaking, larger employers do get much more data about their top disease states than plan sponsors that are smaller, like plan sponsors that are 50 employees or less. There's a couple of different factors that account for that. So credibility, I think, is a very important factor, as well as privacy limitations in terms of the extent of data that you can provide. If we assume that privacy was not a factor, if you have a 50 life group or 100 life group and they have one LTD claim for an extremely rare condition, you can't extrapolate that, to that population, and you can't necessarily expect that that's a factor of that population. So the larger the group, essentially, the more credible their data. And so I think that's a really important factor. One of the interesting things we found in the survey is that even amongst large employers, only about 25 to 30% reported that they get regular reports on their top disease states. And I think in terms of how we move forward with that, I think that if a plan sponsor feels like they're not getting regular reporting on their top disease states, I think they need to talk to their carrier, their advisor, just to see, number one, what kind of standard reporting is available. There could be standard reports that provide exactly the information they need, and they just weren't aware of it. So that would be one solution. And if they're really looking for something unique, then they can have that conversation, again, with their carrier or with their advisor to see if there's any custom reporting available. And I think that could be very helpful as well. But knowing your top disease states is very important, especially for larger employers where the data would be credible.
Thanks, Adrian.
You're welcome.
Last question, I think we have time for one more. I'm going to ask you, Barb. There was a question, what about pharmacare? Was there anything in the survey about that this year?
So yeah, there were questions about pharmacare. We didn't get a chance to touch on them in today's 1 hour session, but the more detailed report will provide that information. Just going by memory, that I seem to recall there was big differences between what employers, plan sponsors think about pharmacare versus what the members think themselves. But where they were aligned was dealing with really high cost drugs, and that there really should be some form of a solution in national pharmacare to deal with those 50,000, 100,000, even $1 million drugs that we're now seeing on the market. So more details are available in the report.
Thank you, Barb. And again, I'd like to thank the wonderful panel of presenters, and I'd like to thank all of you for taking the time out in your busy days to join us today. And we look forward to more interaction. And thanks again. And we'll have a wonderful day, everyone, and stay safe.
Thank you.